Okay, good evening, everyone. Thank you so much for joining us. We're trying to share the videos and then we can start. Uh, Angela, do you want to welcome our people? So, as for this on Instagram, at some point I will switch my camera
Yes.
and
Good
then you'll
evening,
be able
Dr.
to see
Remy,
me.
and good evening to everyone.
You'll be able to see my camera, my laptop to see. Well, yeah, go on.
Good
You
evening,
say you
Dr.
can go on.
Remy,
Sorry.
and good evening to everyone who is joining us on. Can you hear me?
Yes, we can hear you.
Can you hear me?
Yes, we can hear you.
All right. So I was just greeting you and every other person who is joining us today. My name is Angela Okomadu, and I will be assisting our CEO, Dr. Boyede, on today's episode of ATP Live. You know the drill already, but for the benefit of those who are joining us for the very first time, ATP Live is held every Monday at 6 p.m. West African time. It's a live program where you are free to ask all and every kind of child-related health issues, and you will have the CEO offer solutions or at least a guide on what next you need to do. I think we're live on Facebook and on Instagram, and all you need to do is drop your questions and then wait to get a response from the CEO. So once again, you are all welcome to the show.
All right. We're just sharing. Please share the videos to your friends. Invite your friends and family. For those who are watching on ATP Family and ATP Still a Mom, you will have to navigate and find your way to our general to the real page of the video to be able to drop your question because we won't be able to see your questions. But for those on the for those already on our Ask the Pediatrician Facebook group, you can drop your questions directly. So I hope that's helpful. All right, thank you. I'm just trying to share and share. I can see how to share again. More options. Copy link. Okay, I think I just copy the link.
Good evening to everyone who is joining us on Facebook, on Instagram. I already see Omolara.Olawan. Thank you for joining us. Modupe Folarin just joined. Lima Ad just joined. Thank you so much. Miss Nigo just joined. Yeah.
Okay,
And on Facebook, we have three or more people and questions that will begin to come in. So please just drop your questions and we're almost ready to roll.
okay. I guess we've done all the sharing now, so we can start. I can close my Facebook, and then we can get rolling. So I hope the Instagram people are there. Okay, yeah. Can see you guys. Okay, so please drop your questions and then I will answer them. But while we're on Facebook, I'll just turn my camera so that you can see Angela also read the questions. Thank you so much for joining us. You're welcome to ATP Live. All right, so I guess we'll crack on because sometimes we don't want to be running towards the end because once it's 7 p.m., we'll stop taking further questions, but we'll try and answer all the questions that have come in before 7 on the dot. So I guess that's what we are going to do. All right, so let's start. So I'll switch over to,
Yeah.
uh, so you can see my laptop and you can see Um, Angela, read. Okay, good. I hope you can see as much as possible. Just listen, at least as long as you can hear. I hope you can hear very well on Instagram. Let me just check that my volume is on the maximum. Oh no, my volume is, yeah, okay. I guess my volume now is on the maximum for Instagram people. Okay, lovely. Okay, let's go.
Yes. So we have our first question here, and it's saying, my question is on when to give the rota vaccine.
Rota vaccine is surely okay. So rota vaccine is to protect against rotavirus infections. And rotavirus infection tends to cause diarrhea and vomiting, and it's common, especially around between the age of 6 to 11 months. So we recommend that you give rotavirus vaccine at 6 weeks and at 10 weeks. Sometimes there are different types of the vaccine. So you have um, the 3 dose type. You also have the 2 dose type. So if you are giving the 2 dose type, which is the Rotarix, which is the one Nigerian government normally gives, so we usually give it at 6 to 10 weeks. But if you are giving the 3 dose type, which is Rotatech, or there are different brands anyway, but there are just understandable. I've seen some people confused about whether they should give it twice or 3 times. So it depends on the brand that you're giving. Just read the leaflets in the brand. So if it is the Rotatech, then you're going to be given at 6, 10, and 14 weeks. Now, unlike most of the other vaccines that you can just give anytime, even if you fail to give it at the right time, for a rota vaccine, because the rotavirus infection is common between the age of 6 to 11 months. So if you are late, there's really no point anymore. So if you don't give the first dose by 4 months, which usually say 15 weeks, and you have not given the second dose by 8 months, there's really no point to give it anymore. So it is one of those few vaccines that your time of catching up is quite limited. There are many vaccines that even if you don't give it as a child, you can take it as an adult. It doesn't really matter. Something like tuberculosis, because it can still affect you as an adult. But things like rotavirus infection is the peak age is 6 to 11 months. So it's a vaccine that has to be given at the right time. So the maximum cutoff for giving the first dose is 15 weeks, and the maximum cutoff for giving the second dose is 8 months. So if you don't give it within those period, there's really no point. Yeah, so I hope that's helpful.
That's a very time sensitive vaccine.
Yeah.
And this next question is saying, how important is a rota vaccine?
Yeah, so thank you. So I guess that the same person see answering that same question. So the way I always answer the question is that every vaccine is important. Why do we create why do we have vaccines? The essence of vaccine is to protect, or to make sure that you don't have that particular infection that the vaccine protects against. So what it means is that, because some people always ask, which is a follow-up, is that if I don't take the vaccine, what will happen is the fact that your baby will have rotavirus infection if you don't take the vaccine. So you now want to decide, do I want to treat diarrhea and vomiting from rotavirus, or do I want to prevent it from happening? Some people think, oh, diarrhea and vomiting is not so bad. After all, you can give ORS, it can be treated. But in children, if you don't act fast, diarrhea can kill children. In fact, it will surprise you to know that diarrhea, as we all look at it as something not so serious, is one of the top 5 killers of our children. So many children are dying from diarrhea, and that is why the government of Nigeria has to introduce rotavirus vaccine. Remember, there are like other vaccines that the government is not giving you for free that you have to pay for. So for the government to decide to add that vaccine to the list of vaccine that you're given tells you that it's an important vaccine to protect against diarrhea and to make sure your children don't die from diarrhea. So every vaccine is important. If you can get it, get it. I know that some of you are struggling right now because it seems like we have some shortage of the rotavirus vaccine. So, but it is available in private sector. So if you have the money, I will encourage you to buy it. If you don't have the money, check your health center. If they have, collect. If they don't have, well, just hope for the best. But if your child should have diarrhea, then please give ORS, oral zinc, and then see us immediately, because children can lose their water in their body so quickly from dehydration, and sometimes mothers don't even know what to do with diarrhea. What they aim is to be giving something to stop the stool, which is actually not the main important. The most important thing in a child who is having diarrhea is to treat, to rehydrate the child, to make sure that the child does not become so dehydrated and die, because that is what kills the children. It's not the stool. So I hope that is helpful. All right, so I won't be taking too much on each question. So I will
Yeah.
today. All right, thank you. Yeah, thank you, Sylvia.
Thank you, Sylvia. Thank you, Lawal.
Okay.
Okay, this is saying, please, doctor, can a toddler of a year and 3 months have eczema? I noticed some white spot, dotted spots on her face.
Okay, anybody can have eczema, from a newborn baby to to the elderly. Anybody can have it. What is eczema? So I always try to say avoid using medical jargons, because sometimes what you meant is not what a doctor meant, because people use the word eczema a lot. For example, for what you've described to me, it doesn't even sound like what we would call eczema. What you're describing is a completely different skin rash. Because if I see a white dotted spot on a child's face, I'm thinking of a fungal infection. Fungal infection is not eczema. Okay, so eczema is a medical jargon, basically means that the people that have sensitive skin, so their skin is always dry, it's always looking as if they've itched it. We call it excoriated. Sometimes you have like a little bit of wound, those kind of things. So it is a I don't want to use medical jargon again, but it's basically an inflammation of the skin. It's like the skin is irritated, it's dry, it's itchy, if you see those who have it. So that's what we call eczema. Basically, there are different types of it. So the commonest one that most children will have is what we call atopic eczema, or allergic one, or we also use the word dermatitis for eczema in place. So those are the terminologies. So we call it atopic to say it's an allergic kind of skin condition. So what I normally recommend, if your baby has a skin rash, try and avoid making your self-diagnosis. Try and avoid saying this is what it is, because most times you don't know what it is. And sometimes for people like from my states, from the southwestern part of Nigeria, everything is ela, ela, ela. For people from the southeast, it's nla, nla, everything is nla. So, and most of the time, it may look like they look similar, but they are not the same. So there are different kind of skin rashes. They may look alike, but they are not, and they have different causes. So, and a corollary to that question is the fact that it's not the same treatment. So people just think I have skin rash, I just go and buy any cream, and I'm like, what cream are you buying? What are you treating? You don't even know what is causing the rash. You don't know what kind of rash you have, but you just say, oh, I should go buy this particular cream. And those who sell those creams tend to make it sound to you or to the public that as if those skin creams are like your one in all, that's any rash, just put it in, that's the solution. It is complete misinformation. There are different kind of skin rashes caused by different things, and the treatment is different. There are skin rashes that you don't need to treat, you just leave them alone. Maybe what you need to do is to stop the exposure to what is causing the skin rash, what is the trigger. That's all. So there are skin rashes that are due to bacterial infection. The child needs an antibacterial product. There are skin rashes that are due to fungal infection. The child needs antifungal. There are skin rashes that are due to allergic conditions. So sometimes we use anti-allergy medication. So different things. And some of the people that sell those products, sometimes because they want to sell, so they put everything together. They put antibacterial, put antifungal, put anti-inflammatory or steroids, and they say, okay, just use it. It will take care of whichever one it is. It is wrong, because the other ones that the child does not need is going to make the other one worse. For example, if your child has a bacterial infection and you go and put a product that has steroids, it's going to worsen it. So that is why you don't just do one size fits all, niche, those kind of treatment that they are advertised in the radio, the buses and all that. They are very dangerous. Don't do it to skin. So if your child have a skin rash, see a doctor. Let the doctor tell you what kind of skin rash is, and let the doctor prescribe the treatment. Sometimes some skin rashes are not going to, they are going to go and come back. It does not mean the doctor does not know work. It is the way those rashes work. Like, for example, if your child has atopic eczema, it's going to keep coming, just like somebody who has an asthma or somebody who has allergic rhinitis. Allergic condition will keep coming and going for a long time. Sometimes you will grow them, sometimes some people will have them for life. So it doesn't mean the doctor doesn't have work. What it means that doesn't know work. What it means that anytime you have an episode, we have to treat each episode. We can teach you how to avoid it, but sometimes we cannot 100% prevent it, so we just have to treat it. So instead of leaving that doctor to go to another doctor, and you keep getting frustrated, don't do doctor shopping. If you're having recurrent skin rashes, the best person to be seen is your dermatologist, the skin specialist, so that they can explain. And one of the things that most of the time, some of our doctors are so busy, they don't take time to explain some of these things to us. So that's why we have this ATP platform, so that we can explain some of these things. They need to really explain to you, this skin is not going to disappear. It can still happen again. And when it happens again, just come back. So don't get upset, because some of you get upset like, oh, I've seen this doctor A, B, C, and the thing didn't go away. It's the nature of the skin condition. It's not because the doctor doesn't know what to do, but you need to understand. So information, knowledge is very key. As health education is very key as part of treatment as well. But sometimes our doctors are too busy to do all that. So I hope that's helpful. So for this Facebook user, whatever rash your baby has, you really need to see a doctor to know what it is and how to treat it. All right. I hope that is helpful.
Yep.
Okay. I don't know whether there's any question on Instagram yet. So let me just
there's one, yeah. I saw one earlier.
Oh, okay. Okay, if you're able to read from Instagram, that would be lovely. Then I won't have to be turning. But if you can't, I will do it myself. Don't worry. Okay,
Right.
so let's move on.
Okay, so good evening, doctor. My son is 2 years and 1 month. He is not talking yet. Should I be worried?
Yes, you should be worried. A 2-year-old should be talking. So you need to see a speech therapist. That's the first person to say. The speech therapists will do their own bit. If they think there's something more going on, they may want you to see a developmental pediatrician for further assessment if there are other issues apart from the speech. So you definitely need to see. Usually the best thing to do, the first thing to do actually is to go and do a hearing test. I know it's expensive in Nigeria and most of us don't have access to that. So if you are sure your child is hearing, so sometimes we just do the crude test, but ideally in any development, if you are worried about your child not speaking, we do hearing test. So we are sure the child can hear. If the child can hear, then the next step is to see a speech therapist who can do initial assessment and decide, give you some support, therapy, strategies. If they think there are other things going on with the child, then they can refer you to see a developmental pediatrician. Again, not so many doctors are developmental pediatrician. Not every pediatrician is a developmental pediatrician. And some people don't have that expertise. So because of that, sometimes they just give you reassurance and say, don't worry, we'll talk later. Please don't listen to that kind of advice. Preferably, you may want to go to a teaching hospital. You are likely going to see specialists in that setting so that they can give you the right support. So this question is for those from Nigeria because we tend to have that issue. In other places, they know what to do. All right.
Facebook user is asking, can I deworm at 3 months interval, age 1 to 5 years?
We said 6 months. 6 months is okay, not 3 months. 3 months is too frequent. 6 months is fine.
And from Mayokun Abigail, good evening. Please, when my baby cries, she coughs with a whistling sound. The same sound come up when she's doing hiccups. Is it something to worry about?
Okay, so whenever you're asking a pediatrician a question, you need to tell me the age of the child. So there's no every baby. Some people say they're 18-year-old is still a baby. So I really need to know what is the age of this child, so that I can really situate the description you are giving. So repost your question, include the age of the child. That will be helpful.
Okay.
All right. Okay.
Yeah. Ola Mayokun again. What's the effect of almost constant choking or aspirating in baby of less than 2 months?
Okay, Olakonya, I guess this is the same baby that you were asking in this question. That make it clearer. You see, now you have really introduced another scenario completely. If you see the same child and these two questions are linked together, then you really need to see a pediatrician, because your 2 months old should not be choking, should not be having that cough and all that. So if your baby is there are different scenarios. Sometimes if you are not very careful with the way you breastfeed your babies and they are rushing and all that, sometimes it will be like if they want to shock, because when babies are sucking, there's what we call suck and swallow rhythm. In other words, the child suck, gets the breast milk into the mouth, then the child needs to take a pause and swallow and then suck again. So sometimes some babies, when they're in a hurry, they don't follow that suck and swallow rhythm. It's like they just keep sucking and they need to breathe, because children have to breathe through their nose. So if they're sucking all the time, they don't take that pause to breathe in between, then it will be as if they want to shock. But what worries me about your question is that some babies have what we call abnormal connection between the airway and the foodway. So the airway is in front of the foodway, but sometimes some babies have abnormal connection. We call it congenital anomalies, tracheoesophageal fistula. If there's any abnormal connection between the two, your baby can actually be choking or aspirating, or children who have even like heart condition and all that. So it's a very serious symptom in any baby who is choking or aspirating, and I will even worry more when you say almost constant. So that's constant is very worrisome to me, because if it's once in a while, then we can say, okay, maybe because baby is rushing food or something like that. But when it is constant, there's something going on there that we really need to know. So this baby should see a pediatrician like now, like right now, and let the pediatrician evaluate the baby, what you feed your baby, and see. We may need to examine the throat. We may need to check there's no cleft lip or cleft palate, all those kind of things that could, or any abnormal connection between the trachea and the esophagus. We need to check all that, and then that will help us to know what to do. So, because if it's something like an abnormal connection, we need to do a surgery to sort out the abnormal connection, because the foodway and uh, the airway should not be connecting. They connect at the up, where we call the pharynx, and that is why sometimes people choke, because choking basically is the food going through the airway. In other words, food that's supposed to go through the foodway is going through the airway. That is what we call choking or aspiration. So we want to make sure that doesn't happen, and the only way to make sure is that there's no way that is happening. So you really need to see a pediatrician so that they can really if it's a 2 month old, that's very urgent. It's urgent. So you need to do it quickly. All right.
Yeah, this is Mayokun. Another follow-up question.
Mhm.
Sometimes my baby breathes as if her nose is congested, but I see no mucus and was told her chest is clear. What can be the cause of the sound of stuffiness in her nose?
So sometimes maybe just have those kind of noisy breathing, like parents will call it, but there's really nothing wrong. It's because the airway is a little bit flexible. So when hair is going through, you can hear some noise due to the flexibility of the airway, and it's nothing to worry about. But your case is a little bit different, because if you see the same baby you're talking about, I'm looking at the constant choking, I'm looking at the coughing, I'm looking at the whistling, so you've told me so many things about your baby that worries me. So if you have seen a pediatrician, they say your baby's airway is clear, that is reassuring. But if your baby is still constantly choking, you better see another pediatrician, preferably one in a teaching hospital that can really examine your baby properly, because so that we are sure. So it's better to be 100% sure, because it's something very worrisome. Yeah.
All right. I have one on Instagram. Do you want me to take that first?
Okay.
Of
Yeah. Let's go on.
Yeah, it's from Classic Cakes underscore Tosin. My baby of 6 months leg still vibrates, mostly when asleep or sucking. Should I be worried?
Well, if it's during sleep, there's no need to be worried. There's no need to be worried if it's during sleep. So I won't worry at all. If it happens when awake, did you say when awake or sleeping only? Let me read it again.
When
Asleep
asleep
or
or
sucking.
sucking. Yeah.
Yeah, no, your baby should not be. If your baby is sucking, and your baby should not be shaking, the leg should not be vibrating when sucking. So if your baby's leg is vibrating when sucking, I would say do a video of this vibration and let a pediatrician look at it so that we're sure whether the child is actually having a seizure or the child is not having a seizure. That's the most important thing we want to rule out. We want to know, is this vibration what we call normal, we call it normal myoclonus, or is it a convulsion, a seizure, like, we will call it. So we really need to be sure. So once we are sure, then we will take the right steps. So, but the one in sleep is nothing to worry about. But if it's happening when the child is awake, or the child's eye is rolling up, it appears the child is zoning out, or it appears the child is not conscious when doing it, those are the things. For example, if the child is doing it when, if you hold their leg, it should stop. But if the child is not stopping and just keep checking, and the child cries or their height rolls up, those are signs that telling you this is not just ordinary vibration. This is a child having a convulsion or a seizure. That child needs to see a pediatrician immediately. All right. Okay, I think Olakonye really came for us today.
Exactly. She's asking again, what's the cause of
It's okay.
reflux on a
Okay, so
daily in a
yeah,
baby of less than 2 months? Yeah.
yeah. So you really need to be sure whether your baby is aspirating or having reflux, because they are not the same thing. Because you've asked the question about constant choking, and then you're not asking about reflux, because baby don't show when they're having reflux. When reflux basically is a baby bringing back, or like a regurgitation, if you like, of part of the milk they've sucked. So the baby is maybe sleeping or resting, and then a bit of the milk comes out. It's just a little of the milk. It just comes out, maybe soak the bib, and that's it. It is not aspiration. A child who is aspirating is struggling to breathe. It's as if
True.
food may come from the nose. The child is struggling to breathe. And it's a very, very clear episode. That is a child. A child who is having reflux is otherwise sleeping calmly, nothing is happening. Then just a little bit of milk just come back from the mouth, and that's it. It's a very common thing in babies. There's nothing causing it. It is just the fact that the baby is feeding liquid diet, and the space between the mouth and the stomach is very short like that. So and most time also when you finish feeding, you just put the baby flat. And that's what most mothers do. When you do that, the milk just return back. And there's what we call sphincters that's supposed to separate the esophagus and the stomach. So in babies, those sphincters are not very strong like in you. So that is why some of you can eat upside down. You can put your head down and yet you eat and your food will still flow normally, because there's something that makes sure that the food doesn't go back. Once it gets into your stomach, it can't go back the other way. But for babies, that thing number one is liquid food. It is not yet, the sphincter is not yet fully mature. The space is so short. So if you put a baby down immediately after feeding, the likelihood is that some of the milk will go back into the esophagus and come out through the mouth. Sometimes it can even come out through the nose. So what we normally advise is that when you finish feeding your baby, keep them upright for 15 to 30 minutes. It varies in some babies. Some babies have it so bad, like they always bringing back the reflux. So if it's very bad, we usually what we do is we'll thicken the milk. We will give what we call milk thickness. It's the same breast milk, but we'll thicken it. And usually the way you know it's so bad is number one, baby reflux almost all the milk, and the baby is losing weight, baby is not gaining weight. It's very rare to see the severe reflux. Most of babies have the usual one that is so simple, a little bit of the milk, baby is otherwise well, baby is gaining weight well, and nothing to worry about. But if the baby is always, as if baby is vomiting, is bringing out almost everything, baby is not gaining weight, those are the babies that you need to see a pediatrician for. And those are the ones that the pediatrician may use milk thickness, or we can use what we call some antacids and all that to kind of slow down the milk going back. But most of the time, it will stop when baby start taking solid food, because when they start taking solid take-out foods, the chances of it going back is less. But as long as they're on milk only diet, they will still have reflux. But it's not something to worry about. It's one of those minor, we call it minor disorders in children, so you don't need to worry about. So for something like Ola Konye, I think you're a first time mom. I'm almost certain you're a first time mom. Because when you have 6 questions from the same mom, that mom is a first time mom. That's the red a flashing
Red
signal
flag, yeah.
first time mom. So I have a course for first time mothers. It's about 12 weeks course. It's a 14 weeks course that tells you everything you need to know about your babies and all that. So if you want, you can send me. It's not free. It's something you have to pay for. So, but it's something that will help first time mothers. So if you are interested, you can reach out to me later, and I'll tell you how to access the course. Okay. Somebody said they can share our video. So the video should have you can share in the group. You're in the group, you can share in the group. But if you want to share, you have to go to our Facebook page or YouTube channel. Those ones have links for you to share. And I can put the link to share. Let me paste it here. Okay, so I've pasted the link now as a comment. I'm sure you should see the comment. So you can copy down my own link and post it everywhere. Yeah. Thank you.
Okay, this is from Olakonye again. Why does it take long for a baby to burp? What's the effect of laying baby down without the baby burping?
So, what is your definition of long? So, 1 hour, 2 hours, 3 hours? Now, number one, it is not compulsory for you to hear your baby burp. No, it's not. Most time, baby burp on their own. They don't need you to wait or hear them burping. So, sometimes they do it and you don't even know it has happened. So, you don't need. So, like I said, keep your baby upright for 15 to 30 minutes. That is enough. Then you can put your baby flat. You don't need to keep waiting for until you hear the burping sound. It depends on how much air the baby sucking. That's when if the baby taking a lot of hair, you hear the sound a lot. But if not, and it's not really compulsory. It's not something. The reason why we say you keep your baby upright so that the milk at least will settle a bit and have some coagulation, because when the milk gets into the stomach, there are some acids, some enzymes are going to work on it. So if you keep the baby upright for at least 30 minutes, the enzyme work on it, it becomes thicker, curdled. So the chances you can see return. That's why some of the milk that comes back sometimes is thick, it's thicker kind of milk. So that one's already been digested, but it is not going to be as much like the old liquid milk coming back. And the best way to do it is that if you need your hands to be free, put your baby in your car seat and make it vertical. That's all. You teach it to be vertical. That's the best way to do it. You don't need to keep baby on your hands. If you want to, because some baby likes their mom's comfort, put your baby in your what do you call it? The baby carrier. You carry your baby on your chest and your baby is upright. The most important is that the baby is vertical. So you can put the baby in that one and wrap the baby around you and your hands are free to do your work. Or you put your baby in the car seat and teach it vertical. The most important is that you want baby vertical. We don't want baby horizontal for the first 30 minutes of the feed. So those are the acts that you can use without, and you won't be kind of stuck carrying baby and having shoulder pain and all that. So all that's up for. Yeah.
Okay, this is from Nkiru Gazier. Please, doctor, my 4 months baby is very fat that her legs and hands are folding, still on exclusive breastfeeding, and she sucks too much that I think I should minimize her eating just so she will not be overweight. And I always find it difficult to bath her because of the fold part.
Inkiru, the most important information I need is the weight of your baby, which you have left out. So just send me another question, but put the weight of the baby. That is the most important information. Before we get the weight, we can't even answer this question at all. So
All right, good.
the weight of the baby, yeah.
Okay, so Facebook user, what can be used to cure running nose that comes with blood at times? Age 12.
Okay, so running nose means the child has what we call rhinitis. If it is coming with blood, there are many reasons why it can happen, because you didn't really say whether is the child bleeding like blood alone coming out from the nose, what we call epistaxis, nosebleeds, or when the child has sneezed, then a little bit of blood comes with it, because there are two different scenarios altogether. But usually, the most important thing is to make sure when your child has catarrh and all that, you treat it. And most of the time, there are viruses; they don't require any antibiotics or anything. So usually, lot of fluids, vitamin C, something to just boost the immunity of fruits and veggies, and they'll be fine. But if your child is having it recurrently, like it's always having this runny nose and all that, then the child may have what we call allergic rhinitis. So you didn't tell us whether it is something that happens frequently or it's just once off. So if it is once off, there's really no need to worry. Just leave it. But most important is that when children have cough and catarrh, don't let them be poking their nose. Like, some children do that, and in the process, there are what we call blood vessels in the nose, and they can break it and they will bleed. So that's the most important thing. No speaking, avoid it. And if the catarrh is thick, it's not coming out, it's a 12-year-old. A 12-year-old can usually manage that. Let them just take a lot of water. If they take a lot of fluid, it will soften the whole mucus thing and it can blow. So just tell them to blow gently, not with all their force, because when they blow too forcefully, it can also break those blood vessels because they are tiny blood vessels and they can easily break. So that's what you need to do. But if you're having it recurrently or your child is actually having nosebleeds, then you need to see the ENT doctors so that they can support you with that. So you may want to clarify whether it's something once off or something recurrent, and then we can take it up from there.
Right. This is from Singsit Ponsa. Please, doctor, good evening, ma. What makes babies to be big in the womb? Is it genetical or the food the mother eats?
All of the above. All of the above. So there are babies that are big genetically. Like if you are all big in your family, your baby may be big. And if your mother is diabetic, infants of diabetic mothers, they're big. And there are congenital conditions that tend to give big babies. Don't worry, I won't bother you with all those medical jargons, but there are conditions that could make babies to be big. Of course, if you're also eating too much, when you're pregnant, you're not eating for two, you are still eating for yourself only. Of course, you may need a little more calories than when you were not pregnant, but it is not double. It's just a little on the top, and you should do more of the fruits and veggies, protein. Not to let yourself go and take soda drink, drink malts. I'm drinking Milo, all those chocolate beverages and all that. Mothers do that a lot because they think I'm pregnant, and as pregnant mothers, you have all these cravings, and then you want to eat amala 20 times a day and all that. So it will make you. So that is why the doctors weigh you in pregnancy. They weigh you every time you go for antenatal clinic, so that they don't want you to gain more than 12 kilos. Is it 10 or 12, between 10 and 12 kilos throughout your pregnancy? So if you are gaining more than that, because we also want you to gain weight, because your gaining weight means your baby is growing, but we don't want you to overgain. So your doctor will tell you, so they will give you advice, the dietitian will tell you. But if you eat more of fruits and veggies, protein, you'll be fine. But I think the problem is when we take a lot of junk food and a lot of things. But some babies, no matter what you eat or you don't eat, your baby will be big. So if you are diabetic, for example, it has to be well controlled. And it's also, the control also includes food. Sometimes it's only food. Sometimes we have to give insulin, so they will help you with all that. So if you have other genetic conditions, then your doctors will help you as well.
Should we take from Instagram? Should we take from Instagram?
Yes, please.
All right. So this is from Blessing Sunday 975. My baby was born on 34 weeks preterm. She weighed 2.3 kg at birth. Today she is 1 month old and weighed 3.050. I want to know if the weight is okay.
Okay, I'm trying to see the question because I always like to read. Okay, I think we are really gone so far. Oh my goodness. Okay.
The name is Blessing Sunday.
Okay. Please read the question again. I'm lost. I'm still looking for it.
Uh, she said, my baby was born 34 weeks preterm.
Yeah.
She weighed 2.3 kg at birth. Today, she is 1 month old and weighed 3.050
Okay.
kg. I want to know if the weight is okay.
The weight is fine. I think that's okay. No worry. Yeah, the weight is okay. But I think
Right.
you jumped some questions on Instagram already. There's a question here by Dr. Alex. Why is neck rash common among infants less than 6 months? And why is it said that it is less common when the baby starts sitting up and has more neck control? I don't know who said all that, but that is not true. There's no, but no, none of us is saying that about. There's no link between neck rash and baby sitting or baby all those things. No, there's completely no um link between those two. But I will tell you why neck rashes are common, especially in Nigerian mothers. It's because most times we put a lot of things around the baby. So you put the cap on, and then some of you always leave that bib on 24 hours as if baby is always need to use a babe. No. And then some, when your baby has finished eating, they sometimes they reflux and all that, either with the babe or with on their clothes, and it soak into their neck. And some people, when they're washing their babies, they don't wash their babies properly. You need to wash that neck properly. Baby's neck is kind of short, so it's almost like if you don't look for their neck, you may not be able to see. So you really need to take deliberate actions to make sure you wash the neck and keep it dry. Very important. It must be kept dry all the time. So these are the reason. It is not common that babies have neck rashes. No, it's not every baby that has neck rashes. It's not that very common. I think some babies have it because of some of those reasons which I've said. So you have to just make all those efforts to make sure you keep your baby's neck dry. Don't put bib around the neck all the time. Don't wear unnecessarily thick clothing so that baby sweats. Apart from the sweating, all the saliva or the reflux milk, everything is on the neck. You need to make sure you wipe it off and keep it dry always. That will help to reduce the neck rashes. So it is not a common thing, and it's also overdressing the baby. Some people always just want to dress up babies because they believe that babies must not have what's it called? They must not have breeze blowing into them, or they must be protected from breeze so that they don't have pneumonia, which is bullshit because pneumonia is not caused by um by breeze or anything. Pneumonia is caused by germs. So if you're not exposed to germs, you're not going to have pneumonia. So keep your baby well dressed according to the weather, and make sure you keep the neck washed dry always. I hope that's helpful. Somebody is saying, Bodukba Folari is saying, how can I stop my 8-month-old baby from sucking his finger? Okay. So 8-month-old sucking finger is an habit. The best option is not to allow it to have started, but once it starts, it's a little bit difficult to stop. So the best option is to give baby something else to do with their hands. So if they are doing something with their hands, they will not likely be sucking their hand. Most babies start sucking their fingers because of when they are hungry, you don't respond to them on time. So they keep looking for something to suck, or sometimes they are crying, you don't respond to them on time. So they want to comfort themselves. So they start to suck on fingers to kind of suit themselves, so they suck on it either when they are hungry, they need to suck on something, or it's a form of self-comforting habit. So that's why we tell mothers that when your babies are crying, you should be very alert to your baby feeding cues. Don't wait for them to start sucking all the fingers, sucking everywhere before you respond to them. Don't wait for them to cry and cry too much before you comfort them. So those are the little things you can do. But now that your baby is already sucking finger, it's an habit they will outgrow. So give the child something to play with their hands. I find that when they're playing with something with their hands, it will stop. But most of them tend to stop it by themselves around 4 to 6 years. I know some people do it longer, but that's what we do. Just encourage them. But it's 8 months old, there's really nothing you can do with an 8 months old. Just give them something else to hold and play with their hands so that they don't tend to suck on their fingers. And we don't recommend putting bitter leaf on their hands, wrapping it with plaster, all those other things that people do. Please don't go and cause infection on top of the fingers, or don't do that. It's not recommended. I'm sure most of you know too that even with all the bitter leaf you put, everything you put, they will say suck on it, or flagyl. Some of you say we'll put flagyl so it's bitter. Don't do that. Just leave it alone. Okay. So Angela, were you reading from the question section part? I think that's where you were reading from. Is that okay?
Yes,
Not the
from the
comment.
question.
Oh, I get where you read it. Okay, no wonder I didn't get it. Okay.
Yeah.
Some I drop on that comment. So let me just read the comments one because I can
All
see.
right. All
Um,
right.
Champagne. Wow, what's the name? Okay. My 2 months old had a ripe pimple close to a nipple. Should I bust it? If not painful, don't bust it. Oh, please don't. And I don't know what you mean by pimple. Babies don't have pimples in their nipple. So babies can have what we call an extra nipple, what we call an accessory nipple or supernumerary nipples. Just leave it alone. Don't do anything to it. Or just make sure it's not a boy, but you said a pimple, so I'm suspecting it's an accessory nipple. Don't bust it, just leave it alone. And I don't know what you mean by ripe. Is it like it has pores inside or no pores? So you really need to be very careful. But no matter what you do, don't bust anything. If you think it's a pus, like it's a boil, which is not a pimple, because I'm following your own terminology here. So I think the best option is for you to take a photograph of this so-called pimple and post it on our Facebook group. So that let's see it. Let's be sure whether it's a accessory nipple or it's a boil or like an infection, and then we can tell you what to do. But whatever you do, don't bust it for now until you're sure what it is that is actually going on that. Okay. Somebody saying, why is my laptop sideways? Because um I want you to see the person on my laptop. So you can, and laptop is always sideways anyway. Sorry. But if you don't want, I can just I think it should just be boring you seeing me alone without saying Angela with reading from the
Yeah.
Facebook. So I
That's
think
fine,
that is
doctor.
fine. Okay, just bear with us, so don't worry. As long as you can hear us, I think the most important thing is that you can hear us. Don't worry.
Yeah.
Yes, I think I've answered that. Okay. Okay. Well, sorry. Champagne is still asking. I was told in the Ely Center. Oh, I guess you meant health center that there is a new vaccine for kids, not up to 2 years. The name is IPV. Yes, is it safe to take? Yes, yes. IPV is not necessarily a new vaccine. It's just the same polio vaccine you've been taking, but this time around we are using a different format of the polio vaccine. It is so what we've been given before is oral polio, so which they drop in the mouth. So, but because Nigeria is now joining countries that are now being declared polio free, when a country has been declared polio free, instead of giving the oral polio, which is a live virus, we now give what we call injection polio vaccine or inactivated type of polio vaccine. So instead of giving it by mouth, we are giving it as an injection. So that is, we are just going through a phase where we are changing from oral polio to the injection polio, but it's not something relative. It's not like it's a new vaccine, like it's a new disease or it's a new vaccine per se. It's just a different type of the polio vaccine that you've all taken before, and it's okay to take it for your babies. So I think we're now IPV1, IPV2. Hopefully very soon we'll stop giving the oral polio and it's just going to be IPV. Yeah. I don't know whether it's necessary for those of your children who are already 2 years old to take it, but whatever your health center say you should do, just do it, because I think they are just, because we're seeing a process where we're changing from polio free, so it's a little bit kind of dicey at the moment. Just follow whatever they ask you to do. Um, Amadara is saying, can my 7-month-old baby take a whole egg? What do you mean by a whole egg? Like boiled one egg? Yes, why not? Your baby can take it. But please don't give raw egg. Oh, it has to be boiled egg or boiled into pap. Lord, this my writing thing is always going in. Yeah, good. So I've got to stop for. I guess that's all the question. Okay, no, not yet all. Yeah, okay, I've answered that. Classic cakes to saying my baby of 6 month legs still vibrate. Okay, we've answered that. Okay, that's one of the ones. Okay, yeah, you've answered that one. And then bless you. Okay, I think you started taking from the lower part. So okay, I've seen where you started from now, but there are some questions ahead of them that I've just answered. Okay, so bless you. 34 weeks old baby. Yeah, your baby is fine. It's gaining weight 1 kg or almost 1 kilo already. That's good. Just keep breastfeeding exclusively. I hope that's what you're doing. You didn't tell us how you're feeding your baby. That is blessed since Sunday. Just keep breastfeeding exclusively. Um, Bisoye is saying my 11 weeks old baby vibrates when I carry him. Okay, I'm not really sure what you mean vibrate. So which part of the body is vibrating? Is your baby awake or asleep? So we really need to have a clear picture. So you need to tell us which one it is, because I hope it's not that your baby's status, because baby can start to sudden noise and maybe I don't know. So you really need to give me more information, what you mean by vibrating, so that I can give you the right answer. I try not to make assumptions because I may be wrong. So I try to get clarity on what you're asking. So Carrier saying my 2-year-old daughter gets cold and flu almost every other week. Okay. This happens especially when she goes to school. Okay. So when you say cold and flu, do you mean like kata? Because I always want to know what you mean by cold and flu, because different people use different things for differently. If everybody is having it every week and it has to do with going to creche or preschool, the best option is to keep your baby at home. That's it. Keep your baby at home, or make sure because if it may mean that baby is getting it from other people that have the cold and the flu. That's what it means. And so that's option one. Actually, if you notice that when your baby is at home during the holidays, when you don't take baby to the school, because when you say school, I'm not sure what school a 3-year-old is going. As far as we are concerned, 3-year-olds are preschoolers. They more or less play to a play group, so or a crèche. So I really need to get clarity on that. But if you're going to that kind of a setting, like a preschool setting, when you're on holidays, your baby is always having dry nose, no cough, no catarrh, then it means the child is getting exposed to other children having cough and catarrh, and it's always a vicious cycle, because by the time your baby is finishing, then your baby goes back, then another child is already coughing, and the child gets it again, and it goes into a vicious cycle. So the best option is keep your baby at home. Or another reason could be that your baby herself has the allergic rhinitis, that people that tend to sneeze a lot, that have all these running nose a lot, then that is a different condition entirely. And then you need to see the ENT doctors to help you. But for children going to school, the commonest reason they have is because they are getting it from other children who are having it, especially if they don't have a good infection protocol. Ideally, a crèche should have a very strict infection protocol, which means once your child has cough or catarrh, the child doesn't come in, the child stays home. But most parents will beg and lobby and say, "Oh, there's nobody else." So it will not. So if they are not strict like that, then it's keep on happening. So you have to decide which one you need to do, or better say keep the child at home, because it's not really compulsory for them to go to school at that age. Okay, I've answered the question about neck rashes. Okay, I think she's reacting the question. Um, I'm not sure where Carrie say you've seen a lot of pediatricians several times. Are you the one asking about the cold and flu? Yeah, you are the one. Yeah. Okay, so you've seen the pediatricians lots of times, and oh god, let me see. Okay, we've seen the pediatrician. Oh my goodness, this my bending method is not good for me. It's not good for my neck. We've seen a pediatrician several times, but so so for me, when you come to me, that's what I've told you what to do. So the question is not to just see pediatrician and just giving you drugs. The question is why. The most important question to ask is why is it that having this cold, cough all the time? That is the most important question to ask. Is it the exposure in the nursery? Is it an allergic condition? We need to know why. So if you don't answer the why, then you keep on going back to the hospital. So I think you should ask your pediatrician, or you yourself should figure it out. Why is my baby having this recurrent cough and catarrh? Does she herself have something, like maybe she has allergic tendency herself or anything, or is it because she's going into this setting? Is she the only child having cough and catarrh in the nursery, or are there other children also having? So you really need to figure out why. Personally, I always don't believe in just seeing children, giving them medication. You have to understand why, and you need to address the why. and that will help you to know the solution. Because once you address the why, it will keep on happening again and again. Okay, I think I've answered all the Instagram questions, hopefully. Let me,
Yes, I think so.
okay, I guess so. All right,
Back
thank
to
you.
Facebook.
Okay, so sorry, you're going to see my bending laptop again. But at least you can see Angela's beautiful face. All right, okay, let's go on now.
All right. So I think
Okay, we answered that.
we've done this, yes. So Ronka is saying, "Good evening, doctor. My 10 weeks old baby, birth weight 3.55 kg, weight at 6 weeks 5.2 kg, sucks her thumb to sleep. What can I do to stop her?"
I think I've answered this question already. I've finger sucking. So just remove the thumb from the mouth. So obviously your baby is using the thumb sucking to kind of comfort herself. So it's something that they will stop. You can wear something like for this age of baby, 6 weeks old, you can put on maintenance on their hand. It's make it difficult to suck. It may work, it may not. But the most important thing is to just make sure, like I said, babies develop this habit because sometimes we are not sensitive to their cues, and baby has not developed his own our own method of dealing with it. But it's something they will outgrow. So just try wear maintenance and all that and see. Make sure you breastfeed babies before babies sleep, and then let's see whether that will be helpful. All right.
All right.
Our time is
Yeah.
up now.
It's 3 minutes to 7. Yeah.
So please don't
Um,
have any more questions. We take all the ones that have come in already, but no more
all right.
questions now. Thank
Facebook
you.
user is saying, "Hello, doctor. My son just clocked 4 years. He talks, but rarely can express his feelings,
Mm,
like saying, I want to wee and other things. He's not very much aware and conscious of his
mm,
environment. He's intelligent, though,
mm,
but communication is the challenge."
mm. I guess you're asking me what do you do, because you didn't ask a question. You're only telling me information. Okay, but I guess that's what you want to ask. Your baby needs a developmental assessment. A 4-year-old should be talking. A 4-year-old should be communicating to a stranger, and we should have no difficulty understanding a 4-year-old. And so I worry about your baby, and so I will recommend, you didn't tell me if you're in Nigeria, I'll recommend you go for a developmental assessment of irrespective of where you are in the world. um it's important that your child is assessed. You may need a speech therapist, but I think you are going to need a developmental pediatrician more than just even a speech therapist, because your baby is also, you said something like your child is not aware, is not conscious of his environment. Those are very significant information you are telling me there. And I worry about autism spectrum disorder in this child. Even though I've not done an assessment, but that is my number one worry. And that has to be assessed and before we can. And the child is 4 years old, so this is the best time to do an assessment and provide early support, because early support leads to better outcome for the children. I'm happy the child is intelligent, which is good. It means that the child is going to respond faster to our intervention. So the earlier, the better. Yeah.
Stephanie Felix says, "Please, doctor, what can I give my 4.5 years old son for pylori? I
H.
took him
pylori.
to a lab to
Mm.
run the test and they did not prescribe drugs."
Number one, the lab is not supposed to prescribe drugs for you in the first place. Number two, you're not supposed to go to the lab to run a test by yourself. It's one of the things we do in Nigeria that is wrong. How do you even know your child needs H. pylori test? Who asked you to do the test? So Stephanie, I don't know what you didn't even tell me what is wrong with your child. You just told me you went to do H. pylori test and now you want medication. That is not how things are done. When you are worried about your child, you go see a doctor first. You tell the doctor, "Oh, my child has abdominal pain. My child has this. The fact that maybe somebody has similar symptoms and they did an H. pylori test, and you know that, because that is how Nigerians arrive at those kind of that doesn't make you to know what is wrong. It may not necessarily be the same thing with your child. So you can't just assume. That's a very strong assumption. So number one, take the child to see a doctor. Let the doctor assess the child. Let the doctor decide whether this child needs H. pylori test or not. I don't know why you're doing it. Maybe you think your child has ulcer. I don't know. Let them decide. If they decide the child needs to be treated, they will do the treatment for you. But you're not supposed to go. Lab is not supposed. I'm happy the lab didn't prescribe the drugs, because that's good. Some fake lab would have prescribed drugs for you. Don't take drugs from the drugs prescription in children is not the same as adults. We are not giving them smaller doses of adults dose. These are very dangerous things to do. Please, let's the only person qualified to prescribe medication in Nigeria for you is a doctor. So you need to find your way to the doctor. If you have the doctor requested the test, you take the test to the doctor to interpret and then to decide what the diagnosis and then to make the treatment recommendation and do it properly. So please, it's very important, and don't extrapolate symptoms or tests. It's wrong. Please, let's stop doing that. Okay, let's move on.
Yeah, this person is saying my son is 4 months old and his BCG injection site is still swollen, although his own didn't burst. And after a month, we had to remove the pus with syringe, and now it's still swollen without pus in it.
Just leave it alone. I'm wondering why you didn't need to remove the pus with syringe. Did you go to the hospital and they drain it? Because usually we won't drain it. We'll just leave it alone. But just leave it alone. It will clear by itself. If it is having pus or it has ruptured or it's like a big wound, and then you may need to see a pediatrician, there's a way we can treat it. But most time we just leave it alone to clear by itself, and it will do that, and it will leave the BCG scar. It's just like an excessive reaction to the BCG vaccine. We call it BCG abscess, but it's nothing to worry about. So just relax. Is it bothering you that it's big, or is it that it's getting bigger? Or what? I'm not really sure why you're worried. Just leave it alone, though. It's not something to worry about. Okay.
Okay, going on. Good evening, doctor. My baby does sound as if he wants to poo hard, but nothing is coming out, and also his poo is not hard. Should I be worried? He's 4 months old.
There's no need to be worried. That's perfectly normal. Yeah. Let's move on.
All right, can I treat infection while I'm still breastfeeding? My baby is a year and 2 months.
Which infection are you treating? So, number one, don't self-medicate. Don't treat yourself. Go to a doctor, and the doctor will treat you. And the doctor knows what drugs to give a woman who is breastfeeding and what's not to give a woman who is breastfeeding. So, but please don't treat yourself for anything when you are breastfeeding. Pregnant mothers, nursing, breastfeeding mothers, you can only take medication prescribed by a doctor. It is very important. There are medications we can't give you, because if we give you, it will go through your breast mix to your baby. Some of you, for example, you have diarrhea, you just go and take tetracycline. If you are breastfeeding, you are not supposed to take tetracycline. Even children below 8 years are not supposed to take tetracycline, because it's going to damage their teeth forever. So this is just an example. So please don't self-medicate. Don't use antibiotics that is not prescribed by a doctor. These are things that doctors will know. So sometimes it looks like doctors are just doing the same thing, but there are things that guide those decisions. So when they know that you're breastfeeding, they already know I should not give this woman this particular drug. But some of us don't know that. You just think it's infection. Let me just treat. Please don't do that. That's why you should not self-medicate. You should see your doctor and let them be the one to tell you what to use. And always let them know, if you are seeing a new doctor who did not know you before, let them know I'm pregnant. Let them know I'm breastfeeding, so that they will know how to make sure they give you the right kind of drugs. I
All
hope that.
right. Yeah. Precious is saying, good evening, doctor. When my baby sucks at night, it sounds as if she has blocked nose. I'm guessing she wants to know if
Yeah,
the
sometimes,
problem on.
well, as long as baby's nose is not blocked and baby is sucking well, I will not worry about it. So all those sounding as if it's just you as a mother's perception, there are some that babies make that is perfectly okay, and we will not worry about that. So don't worry.
Please, why is baby of 4 months head still not stable?
Okay, so your baby has developmental delay. If at 4 months old, your baby is still not having neck control, so you really need to see a pediatrician, because a 4 month old baby should have neck control. You understand? So this is a sign of you're asking me why. To answer that why, I need to ask, like, many questions like what happened during your pregnancy, what happened during your labor, what happened during your delivery. That is when I can answer your why. But what I can just tell you now is that your 4 months old not having a stable neck is not okay, it's not normal. There is a problem, is what we call a developmental delay. Why that delay is what we need to answer, but more importantly, we need to address the delay itself. So you really need to see a pediatrician now. That's very important to do. Oh, thank you. Angela, you see there? Angela. Okay, Angela disappeared. Kelemu Victory is saying, good evening, doctor. My baby is 3 weeks old and she's always sucking, never full. Wow, really? How do you know she's never full? She emptied the breast, I will not be full. Will you advise her introduce formula? No, Victory. Your baby is full. You are the one that doesn't understand why your baby is not full. So the fact that your baby is sucking and sucking and sucking does not mean the baby is full, especially if you are lactating, unless you're telling me you are not lactating well. But obviously, you are telling me that she will empty your breast. So I guess that means you are lactating and your breast is emptied. And that means your baby is getting enough. To be sure, you can actually press out the breast milk itself and see how much of it you bring out. Then you know how much quantity you can actually feed your baby with a cup and spoon of express breast milk. So you really know how much quantity is going into your baby. So your baby sucking does not mean baby is not full. Babies suck for different reasons. So sucking is not just about food for the baby. So that is the one most mothers know. But the other reason why babies just also suck for pleasure. So sometimes they are sucking because they just want to suck. There's no other reason than the fact that they just want to suck and they want to suck. That's all. And baby also suck because it keeps them close to you. So it's their way of bonding with their mothers. It's a way of feeling your warmth. It's also for them a security, like this mother is not going to run away, she's going to be there. So they just want their mouth on that breast all the time. So if you are sure you are lactating well, your breast is full of milk, your baby has emptied the milk, just stop the baby, just remove the baby from the breast from the mouth and just rock the baby to sleep. So the baby may cry. That does also not mean the baby is not full. So I've told you, if you really want to be 100% sure, you can express your breast milk. If your baby is taking like 60 to 100 ml of breast milk, that is more than enough for a 6 weeks old. I mean, a 3 week old baby. So the baby is getting enough of breast milk, and your baby can suck that like every 3 hours. So you need to understand that there are also periods that babies go through this fussiness. They just want to keep sucking. It's not because they're not getting enough breast milk. It's just about the other reasons why babies suck. So it is not just about breast. It's not just about baby being full. So if you go to our Facebook group, I think you're not on our Facebook, you're on our page. If you go to our Facebook group, we have the breastfeeding videos. There's one on how to know whether your baby is getting enough breast milk. So you can go and watch that breastfeeding video. How do I know my baby is getting enough breast milk? And of course, the most objective way to know your baby is getting enough breast milk, like your baby is gaining weight. So this your baby now, go and weigh the baby and let us know what was the best, so what is the weight now. Your baby is gaining weight, then that means baby is getting enough breast milk. So sucking or crying are not evidence of baby getting enough or not getting enough, especially if you are lactating well. Not that you yourself are not lactating, but if you are lactating, your breast is filling, you can express it out, you're seeing the milk. Then the fact that your baby keeps sucking does not mean your baby needs formula, and does not mean your baby is not getting enough milk. So you just need to understand the way baby thinks and why babies suck, and that will help you. I think it's one of the commonest reason mothers struggle with exclusive breastfeeding, because they always feeling like, oh, I'm not lactating, or oh, my baby is always crying, my baby always wants to suck, then that means I'm not giving enough milk. And the grandmothers, apologies to most of them, but they are the one that's always number one to say that means your baby is not getting enough milk, you better go and buy formula. It is not true. It is not true. So keep to your breastfeeding, keep breastfeeding your baby. It's a passing phase. Most of them outgrow that. And just understand that every sucking is not about hunger. Every sucking is not about food. Sucking is pleasurable. Sucking is for comfort. Sucking is for feeling the warmth of the mother. Sucking is for security for the baby. So those are the other reasons why babies suck. So it is not just about because they are hungry, because that is why for some of you will also do formula, then you say, oh, baby is also still sucking, it's still not full. So then you know that there's a problem. So please don't jump to formula so that you can maximize the benefit of exclusive breastfeeding. I hope that is helpful. But I think you are going to be able to. Yes, Modupe, thank you for that. I think I've answered all the questions on Instagram. I think so, but I'll come back to them. I'll come back to the leftover question on Instagram. Thank you for that. Okay, Angela, are you back now? Angela, are you back? Are you frozen again? Okay. Ankipola is asking what can cause hair loss in babies and how is it treated? There are many causes of hair loss in babies. Some of them are normal, they don't need any treatment. There's what we call hair circle, in which babies also lose some hair and then the hair will grow back again later. Some are due to, like, if there's scalp infection or maybe cradle cap, like something like some other kind of infection on the scalp. They can happen, and when they happen, baby can lose their hair with the cradle cap or with we call it seborrheic dermatitis and all those kind of things. Even things like even like fungal infection, all those things, they can make baby to lose their hair. So the most important thing is to know which one is causing this baby's hair loss, and then that will help us to know what is the appropriate treatment for it. So you really need to be sure. So I'll always say, don't do anything by yourself. See your doctor first, then we can tell you which one we think it is, and then that will help us to know appropriate treatment. Okay, I hope Angela,
I'm here now. Internet has been
thank you.
disturbing.
Yeah.
Okay. My son is 15 months old and is pooping since Thursday, and we have been to hospital but no change. We have been given metronidazole, and today we have been given Nosclav powder and ORS.
Okay, so number one, if your baby is pooping, that is passing watery stool. I always like to be very, very specific. As I assume this is a watery stool that is diarrhea, because what you've told me now, my baby is pooping since Thursday, there's really nothing abnormal in the baby passing stool, because you've not really given me any information. But if you mean, but I'm assuming, because I always also understand when mothers use certain terminology. So I guess you meant your baby is passing watery stools. Number one, it has to be watery stool for it to be abnormal, and that watery stool has to have been passed like 3 times in a 24-hour period for it to be abnormal. So if your baby pass watery stool once in a day, that is not yet diarrhea. We don't classify it as abnormal. So if you say your baby since Thursday has been passing diarrhea, what your baby needs is ORS. Today is what? Today is Monday. So your baby has been passing watery stool for 4 days. What your baby needs is ORS and oral sync. The ORS and the oral sync are not meant to stop the diarrhea. That is the problem, because you say, oh, we've been to the hospital, no change. There will be no change because there's not supposed to be any change. The diarrhea is going to stop by itself, and it's going to stop maybe within 10 days. So there's really no reason to worry. What you really need to focus on is to give your baby ORS, rehydrates your baby. What gives a child who is having diarrhea is not the stool, it's the dehydration. It is the loss of the electrolytes that is going to cause it. So what we need to do is to keep replacing what the child is losing. All these antibiotics you are giving your baby is completely unnecessary. They don't need it. The Nosoclav, which is, I think, is augmenting form of antibiotics, is going to make baby pass more watery diarrhea, because that is one of its side effects. So if your baby doesn't have fever, baby doesn't have blood in the stool, the baby does not need any antibiotics for diarrhea. So you should stop the messenger. So it's going to make your baby have poor feeding, because one of the side effects is nausea and vomiting. So you're going to worsen things. So, and I know doctors give you this antibiotic because you are disturbing them all the time, because you've gone on Thursday and you are worried, and you've gone again today, then they say, okay, take this, take that, so that you stop coming to disturb us. But seriously, they are going to make things worse. So you need to really understand what is happening. And what is happening is that in a child who is having diarrhea, most of the time they are caused by viruses. They don't need no antibiotics. They just need to replace what the child is losing. The child passing the diarrhea is a good thing, because the child is passing out the virus and all of them and which is better because rather than it's being stuck in the child's body, going into the blood and all that. So the most important thing is to replace the fluid, and don't worry about the diarrhea. Just forget about it. Focus on rehydrating the child. The diarrhea will stop on its own because it will stop when the new lining of the intestines have been formed. Okay, so I know it's crazy. I really wish we have some way of getting this done, but mothers worry so much about diarrhea, but we are not worried about diarrhea. There's no drug to stop diarrhea. We don't want you to use drug to stop diarrhea. We want you to just replace what the child is losing, and don't give antibiotics. I know your doctor have given you these antibiotics, but they are really not necessary, and I hope they don't make things worse unless your baby has other symptoms, like if your baby also have fever, have other symptoms suggestive of infection, which you have not said in your question because you only said your baby is passing diarrhea. So I'm going by what you've told me. But if there are other reasons why your doctor has prescribed antibiotics, all well and good, but if it's just diarrhea alone, no fever, no vomiting, there's no need for antibiotics. ORS alone we do. All right.
Yeah.
Let's hurry up.
Okay, so please, Ma, my daughter of 3 years old is like having some odor in her mouth when she talks after daily brushing of teeth. Please, what is the cause and what can I use to clear it, eradicate the odor at this her tender age? Thanks in anticipation.
There are many causes of mouth odors, what we call halitosis. So we need to know what is the cause. It is not just about oral hygiene. It's not about brushing the teeth. It's about if any infection around the throat, tonsillitis, adenoids, anything around the mouth, the neck, the throat area, they can cause mouth odor. So what you need to do, Faith, is to take your baby to see either a pediatrician or a dentist. Either of us can see, and we will examine the child first to know why the child is there anything else around that throat area that is causing the odor. Then we will deal with that, and that will be the solution. So that's what you really need to do. You need to know why first, and then that will help us um to know what to do. Yeah.
All right, thank you. So we're moving on. Can a baby taking formula be okay? Mother suffered from eclampsia. Breast was stopped. I think that stopped. Baby is 4 months now.
I don't know what you mean by stocks. Is okay. The question is the mother okay now, or is the mother what is the situation
I
of the
think she
mother?
meant breast milk was stopped. I think that's what the person meant. Stopped.
I don't know. Anyway,
I don't
usually
know.
when a mother has eclampsia, it means a woman who has convulsed during the process of having a baby, and obviously most of the time they are unconscious, so they cannot breastfeed their babies. You can give formula in that instance. This is one of those instances where that is actually why we still need formula company, because there are sometimes the mother is not available and there's no breast milk available. In the olden days, we would have taken breast milk from other mothers, but with HIV now, we're being very careful. So you can give formula. But if the mother is well now and her breast is, she can lactate, then she can breastfeed her baby. So I think we're lost somewhere in the middle. So I'm not so sure. But if you want to clarify, our time is gone, but you can ask on our Facebook group. So let's just roll down because our questions are
Yeah,
okay.
we still have plenty of them. My
Maybe
baby of
I should
two
just
years.
yeah, maybe I should just read them one quickly and just run through them. I mean, not read all the questions because I'm just going to project it and run through the answers quickly because of our time. We're already so late. Okay, Facebook user, my baby 2 years old, conversion 1 month ago, use Phenobarb. Uh-uh. So you need so this baby has convulsion. Is it just 1 month ago? How many times you didn't tell us? Is it with fever or without fever? You didn't tell us. Don't just go use Phenobarb. Please go and see a pediatrician or a pediatric neurologist immediately. Please, please, this person is very important that you don't use Phenobarb, but you need to see a pediatrician so that we can give you the right answer. Okay, Olakonya, I know you're a first time mom. Definitely, I've seen all the telltale signs in you. Okay, Facebook user is saying my baby of 1 year 3 months is not walking. She's crawling. Blah blah blah. What could cause the delay in walking? There's not yet a delay. So if your baby is not yet walking by 18 months, then that's when you should see us. Say 1 year 3 months, that's 15 months. So just give a little more time. By 18 months, let us know if the baby is not yet walking. Is it good to give a little pepper to a baby EBA before 6 months? No, no, no. Don't give pepper to EBF babies. Just give them breast milk. You eat the pepper. They will taste the pepper in your breast milk. That's all. That's fine. Please don't do the pepper. I know you people like to do this. Okay, yeah, this person is answering my other question. Your baby is sneezing severally. Yeah, so if it's something that happens a lot of time, you need to see the ENT doctors. I'm sorry I'm rushing. You can watch the videos later on and catch and slow me down to hear it better. Oluchukwu is saying, my baby is 5 weeks, so is it possible to overfeed an exclusive breastfed baby? Why sometimes while feeding, she throws with breast milk flowing through the nose and the mouth. Well, it's possible to breastfeed, but what you've described is not necessary because you've overfed the baby. That sounds to me like a reflux. So sometimes if you think your baby, it's just because the baby is not yet coordinating the suck and swallow. I don't know whether you were watching from the beginning because I've explained that. So babies need to take a breath in between when they suck and when they swallow. Sometimes babies don't do that, and that can make them to bring back the milk. So what you really need to do is to slow down the baby when sucking. If you think your baby is rushing, especially when they are rushing, just put your finger in the mouth and depress it and stop. Let the baby breathe a while, and then you start again. That will help them until they master it by themselves. One of my twins is less than twin B. Yeah, that is normal. Why should you be worried? Okay, well, you didn't tell us their age. Okay, at 10 months old. So 10 months old should weigh 9.5, but you didn't tell us the birth weight of your twins because your twins could have been small when they were born. So now you didn't tell us the birth weight of each of the twins, but you are saying twin B has more weight than twin A at birth. Okay, is it twin B that is smaller? Okay, is it twin B that is bigger now from birth? Okay, twin B, yeah, so they are still following their normal pattern. So twin B was bigger at birth, and now twin B is still 9 kilos and twin A is 7.8, which is fine, which is perfectly normal to me. So, but you didn't tell us what their weights were at birth because that will help me to know whether your baby were born at 9 months, whether they were small babies. But I'm not really worried about their weights. And because they are twins does not mean they have to have the same weight. So that is how life is. Everybody is different. Even twins, they are still different. Okay. Tokpa is saying, is it normal for a 7-year-old to snore while sleeping? Well, it's not really normal, really. When you snore, especially snore loudly, we need to be sure there's no. Some do it as an habit, maybe the posturing of the way they sleep. But if a baby is snoring, I want to forward check to make sure they don't have enlarged tonsils, adenoids, and things like that. So I really prefer you see a doctor first and not just assume, especially if it is snoring continuously loudly. At least let's be sure there's nothing wrong. If there's now nothing wrong, then we know it's just a habit and all that. Okay. What causes jaundice in babies at birth? Is it infection, hepatitis B, or malaria during pregnancy? There are so many causes of jaundice. Infection can cause jaundice. Hepatitis can cause jaundice. Malaria does not cause jaundice. So, but there are other causes of jaundice that you have not mentioned. So, what you really need to know is to ask your doctor, what is the cause of jaundice in my baby? Because your doctors would have tried to figure out what is the cause in your baby, and then they can tell you what to do. But if you want to really know more about jaundice, if you go to www.askthepediatricians.com, type jaundice into the search button, you will see our articles on jaundice, and then you can see all the causes. So there are different kind of jaundice. There's even jaundice that is normal. We call it physiological jaundice. So I don't want to go in because that's another topic on it. We'll start go there here talking about jaundice. My baby have catarrh for 1 month. You didn't tell us the age of your baby, so how do we know what to anybody having catarrh for 1 month, that's a long time. So you need to see a pediatrician for proper evaluation. For example, depending on the age of the baby, maybe a baby has, if it's a child like a toddler, maybe they could have put something in their nose, for example, and they'll just keep having the discharge and all that. So, but you've not told us the age, you've not told us any other information, so it's difficult to give specific answer. There's nothing wrong with the baby's nose making sounds when sucking and out. Please, when you're asking questions, please always put the age of the baby there so that I know who I'm talking about. So it's very important. Rosemary said, my baby has burns on their neck. I need to know the reason. We need to see these so-called burns because obviously they are not burns because you've used the word burns, which means when we use the word burns, we meant it's like you pour hot water on the neck, which I assume that's not what really happened. But I guess you are trying to tell us what is on their neck look as if they had the burns, but you've not even told us it's a little bit difficult to answer your question because we need to see what it is, and then that will help us to know what exactly is on the neck and what to do about it. And we don't recommend use powder. They have, so your babies obviously are having rashes. They have nappy rashes. They also have neck rashes. There are many reasons why babies could have that. Even though your nanny said they change the nappies often, doesn't matter. You need to put a nanny cam. Changing nappies to some people means it is only when there is a poo inside the nappy they will change it. Whereas for us, change nappy even when it is wet and there is no poo inside. So that is number one. Number two, you need to use diaper cream on the nappy areas, things like zinc oxide, shea butter, Vaseline. What's the other one? I forgot the name of the one I want to say now, but you know the one I want to talk about. So you can use that on the nappy areas, and don't use powder in the nappy areas, which is the commonest reason why babies have rashes, because most people put powder in the nappy area. Then when your baby wee, the baby just makes the wee and the powder together, form a very nice paste that irritates the skin. The essence of what you are putting in the nappy area, all those products I've mentioned, is to create a barrier between the skin and the waste product, so that in that interval when you will change, and that's why you also need to change it frequently, so that the those urine or stool, um they don't irritate the skin and cause a rash. So these are things you really need to follow and make sure. Then some nappy rashes are actually not due to irritation or skin. They are actually infection, maybe a fungal infection. So those ones are not going to respond to your shea butter or all those things that you're using in the nappy area. I hope you're not using that powder in the nappy area. You should stop if you're doing that. Those ones need to be treated by a pediatrician. And I have a feeling that maybe that's the case in your baby, because there's something on the neck and there's something in that area, sound like a fungal infection ongoing, which you need to see a pediatrician for, which needs to be properly treated. So I hope that's up for. Thank you for telling us the age of your baby finally. 6 weeks Facebook user. 6 weeks old, cry before poo, and sometimes the poo is green. Babies can cry before the poo. That is perfectly normal. There's nothing wrong with that. But the poo should not be green. Green poos means you are not breastfeeding well enough. So please breastfeed your baby frequently. Make sure they empty the breast so that they can take both the beginning part of the milk and the end part of the milk, which has the fat and all that. So they must empty one breast, and then when you want to start again, you start with the second breast and you exchange the breast like that. Don't just stay on only one breast, and don't start with the beginning and don't end it, and then change to another one and start from the beginning and you don't end it. So what you are ending up doing is to give lots of water but no milk. The thick, the fatty part of it is left. So you have to empty one breast before you go to the next one. I hope that was helpful. And breastfeed at least every 3 hours, on demand though, but you can do at least not less than every 3 hours. Amabi Kaja, can I use Procode? I don't know who you are. You didn't tell us your age. You didn't tell us who you are. You didn't tell us why you have to answer that question. So you really need to be very careful. Please, can a child take amoxicillin for infection after using fluticasone nasal spray? You don't use antibiotics if it's not prescribed by a doctor. Please, mother, stop antibiotics abuse. It's an epidemic in Nigeria. We need to stop. Okay, I've answered this question already. Okay, you are a breastfeeding mom. Oh, thank you for telling us. Can I use Procode? What is in Procode? I can't remember now, but I really would not recommend anything for you. If you're a breastfeeding mother, I would just say drink a lot of water, take your vitamin C. If you're having headaches, use paracetamol or something. Avoid as much as possible. This Facebook user, we've answered your question now about your baby's neck not being stable. We've answered that question. You need to see a pediatrician. And I've told you, I can't tell you why it is not stable, because I need to ask you so many questions. What happened during your pregnancy? What happened during delivery? Is it that your baby did not cry at birth? Is your baby a preterm baby? These are the ways that we know why your baby's neck is not stable. But your baby's neck not being stable is not okay. That's all I can tell you now. But to tell you why, you need to sit with me for another 30 minutes for me to ask you all those questions to tell you why. Margaret, my baby is bending neck to one side. It's 5 months old. Will it correct later? I'm worried. I'm not so sure why your baby is bending the neck to one side. So we need to know that first. treat that, and then that will tell us whether it will correct or not. We call it torticollis when babies bend their neck to one side. It could be due to infection. It could be due to some other issues with the neck. See a doctor and let them be able to tell you why. Oh my goodness. 4 months old BCG site is swollen without pus in it. X-ray says it's soft tissue. Oh, there's really no reason for you to go to X-ray. Uh, there's no reason for you to do anything in the first place. Just leave these BCG sites alone. Okay, just leave it alone. We know why it is swollen. We know it's a BCG site. It's going to go away. Just leave it alone. Stop worrying about it. I know I don't know why you're worried, but you don't really need to be worried about it. Just leave it alone. Exposing your baby to X-ray is dangerous than even the BCG side that is swollen that you're doing. Please don't go exposing a 4 month old to X-ray for no reason. There's really no point for that. If I thought you want to do anything, it should have been an ultrasound, not an X-ray. Please avoid X-rays as much as possible unless we need to really make a diagnosis. It's not a good thing to do. I see my question on Facebook. Really? I'm not sure. Did we skip any question on Facebook? I see, because you're a Facebook user, we can't even see your name, but I don't think we skipped any question. No. Ask your question again. We apologize if we really skipped your question, but I don't think I can't remember skipping any. Can I maybe take your formula? Okay, we've answered this question already. Yeah, we've answered this question. Okay, is there any new thing? Okay, breast was stopped by doctor. Okay, we now understand. Yeah, but is the mother okay now? Which is what I really want to know. If the mother is okay, then please give the breast milk now. My baby has noodles. I've been trying to vomit up to 3 times. You don't need to deworm. Vomiting is not deworming. It means the baby is allergic to something, your noodles or something. So every vomiting is not deworming. Deworming is at 1 year. It's not because all these the other people ate the noodles and they didn't vomit. So I don't think so. I think maybe we should just stop giving the baby noodles for now. Okay, I can't remember who is 18-month-old. I can't remember. If your baby BCG is not showing you if you can't see the BCG scar, four of us see a doctor. Let's check, because sometimes some of you say there's no BCG scar, but there is, but you don't know how to check for it, or you're not checking the right place. Let's check first. If there is no BCG scar, we will check to make sure whether the baby has reacted. So we'll do what we call a mantle test. If we do a mantle test and there is no reaction, then we'll do the BCG again after we've ruled out the baby doesn't have tuberculosis ongoing already. So you need to see a pediatrician or a doctor, and then okay, you have the H. pylori here. Okay, I understand what you're saying now. Okay, I took him to the test but your baby doesn't have any symptoms, so we don't look for what is not lost as generally as a doctor. So the fact that you have H. pylori does not mean we need to be treating your baby for H. pylori if your baby is not having symptoms of H. pylori and all that. So yeah. Okay, I think you have Stephanie, I think for your own case, because you have trust issues with your hospital lab, but I'm still looking for one thing. Your baby, what symptom did your baby have that make you to take the baby to the hospital for treatment? You didn't tell us that. I didn't see where your baby is sick. Your baby is just 4 months old. How old is the baby again? I can't remember how old the baby is again. Okay, I can't remember. But I think you should. Personally, I think you should not worry. If you have H. pylori, don't worry about it. If your baby is not having any symptoms, just leave the baby alone. Just leave the baby alone. So, but if your baby is having symptoms, then tell us, and I'll tell you what to do. And the best people to really see is the pediatric gastroenterologists. Those are the people that handle things like that. I don't know who is this question. My baby is 4 months old, is weighing 9.65. That's a little bit on the high side, but no worry. Just keep breastfeeding, and we'll leave it. Okay, I think we've done all the seven questions. Sorry if your question.
Yes, we have.
Yeah, if your question is after 7, please. I'm sorry, I won't be able to take it because there's, oh my goodness, there's so many, and we're already over like half an hour beyond our normal time. But I will finish
Yeah.
the Instagram people because somebody is complaining I didn't answer Instagram people. I will answer the Instagram and then I will close it at that. Okay, I've answered the neck rashes. I've answered this one. Oh, Instagram people, sorry. Oh my god, this is my Instagram. think I may have to put it in the straight position. Okay. Let me just put my Instagram straight because my bending my neck is really not good for my health. um Okay, so Shami for King is saying, if a nursing mother does not feed well for a week, does the quality of her milk reduce? Not really the quality, but with time it will begin to reduce. But usually the body will keep on still producing, taking away from you. But it's better you eat well so that it doesn't keep, because after a while you will not be lactating well enough yourself. Okay, Buku is saying, I told my mom not to press my baby's swollen breast and she listened. Thank God. But we are worried because the breast is growing bigger. Just leave it alone. Don't worry. I hope you have not pressed it before, and if it is not red, if it is not painful, if it is not showing like there is pus inside, just leave it alone. It will reduce by itself. Just leave it alone. But if you have pressed it before you had Dr. Gbemi said don't press it, and it's now red or infected, then you really need to take it to see a doctor. Okay, somebody is asking about taking a full egg. We've answered that question. Yes, you can. Quality of breast milk remain the same. We've answered that question. At one's age, does one know for sure if your one child is autistic when the doctor give you the diagnosis? But some people know as early as 9 months, some people know as early as 1 year. But most of the time, we try to do the assessment between the age of 18 months to 2 years. So most children are diagnosed between the age of 2 and 5 years old. Yeah, so we always know. But some mothers have told me they know right from the time the baby was 9 months old that there's something wrong. They may not have a diagnosis, but they know there's something wrong. But most time the pediatricians will give you a diagnosis. It depends on when we do the assessment. We can diagnose it at any time once we do the assessment. Okay, Omolara is saying when a baby starts eating. When does a baby start eating? It varies from one baby to another, but most babies start bringing out their first tooth by around 5 to 7 months. And stooling is not a sign of teething. Stooling is not a sign of teething, and teething does not make baby to stool. Don't buy all those myths. B Sugar is saying my baby of 6 months is always holding and pulling its hairs. Should I be worried? Yes. It's better you get a doctor to look into the hairs, especially if the baby is also crying. Some baby pull their hairs a bit, but some, when they are pulling it, they're in pain, then that's worrisome. So it's better you let the doctor just look into the hairs and be sure. And Omoti is saying 18 months old who is yet to walk, but pull himself up by walking using the edge of something to aid his walking. I think you should see a pediatrician. Yes, if an 18-month-old is not working, no matter what the 18-month-old is doing, we've given enough time. Most babies work at 1 year, so we've given you an extra 6 months to catch up. If at 6 months extra time, the baby is not yet working, there's something definitely wrong, and we need to take it up from there. So please, you need to see a pediatrician. Baby is a bit big though. 16 kilos is the weight of a 4-year-old. So that baby is too big as well. That may also be contributing to why the baby is not working though. So, but you need to see a pediatrician as well. My baby poo color is green. Is this normal? No, it is not normal. Please make sure you are breastfeeding well. Yes, I've answered that question. So your baby's poo being green is suggestive of most likely inadequate feeding. So you really need to make sure you are breastfeeding well, on demand, exclusive breastfeeding. Okay, Bisoye, I'm misfeeding because milk supply is low. I've tried everything, including pumping like 5 days daily. My baby is 11 weeks old. Okay, I guess you are just giving us information because you did not ask any question. 6 months old, the pool on his right here. We've answered that question. Okay, I think Instagram people were repeating the question because I didn't answer. I'm sorry. My baby is 4 months old. Since birth, she has cold. No, how can a 4-month-old has cold for 4 months? That's not appropriate. You really need to see a pediatrician now. There's something going on. It's definitely not cold. 1 year, 2 months, she pulls both dark green and yellow. Should I be worried? No. It depends on what your baby is eating at that age, because at that age they are eating varieties. So the color, if they eat like vegetable stuff and all that, you can show in the pool. It's different from the green stool of a breastfeeding baby. So there are two different things. So that's why sometimes you don't just jump to conclusion based on one person's Yeah, okay. I guess that's all on Instagram. I guess so. Okay, I guess I might need to answer Instagram people. Unfortunately, Facebook user that came in after 7, I'm so sorry. I won't be able to answer your questions. But what I would advise you to do, please post it on our Facebook group, and myself and my colleagues will answer it. Um, will answer. We're actually supposed to do 6 to 7. We've already done 40 minutes extra. So
40 minutes extra, yeah.
no, we've really tried. Mabinu. So apologies, we can't take questions today. Try and come in earlier and drop your questions and we can take it quickly. And if you don't take your question, not to worry, whether on Facebook or Instagram, don't worry. All you need to do is to put your question on our Facebook group, Ask the Pediatrician's Facebook group. Mondays to Saturdays, we will answer your questions, and 24 hours we are there. If you have adult questions, you can post it on our ATP family Facebook group. And if you are a mom who has been bereaved, loss of pregnancy of a baby or a baby, we can support you on our ATP Still a Mom Nigerian Facebook group. So you can also join the group. You have to, that group is more restricted. So if you don't answer the questions to say you have actually been bereaved or you are a professional, we're not going to allow you into that group because it's a very sensitive group. So we don't just allow, we are not looking for crowd. We actually don't want many people. We just want to support those who really need support. So thank you so much. Thank you, Angela.
Thank you, Doctor. Thank you to everyone who joined us too. Yeah. From me, have a good evening. Bye-bye.
Bye.
Bye.
Bye. Okay, let's stop.